Welcome to 10 Career Questions. My name is Kevin Abnell, and I'm the Executive Director of the York County Alliance for Learning. This video is part of a series of interviews where we speak to various professionals working within each of the 16 nationally recognized career clusters. The purpose of this series is to get to know people working within each career cluster and to help promote a better understanding of various career paths. Resources like this video are intended to help promote career awareness and career exploration as students move closer to making important career decisions. This video series is presented in part by a grant from the FirstEnergy Foundation and a business education partnership grant provided by South Central PA Works. We thank both of these organizations for their support in helping YCAL continue to engage students with career education and development opportunities such as this video series. Today we'll be speaking to someone in the Health Science Career Cluster. This career cluster is focused on planning, managing, and providing therapeutic services, diagnostic services, health informatics, support services, and biotechnology research and development. Thank you for being here today. Welcome to 10 Career Questions. We're going to get started with question number 1. What is your name and who do you work for?
Hi, so my name is Kaci Dennis, and I work for OSS Health and also Dreyer Physical Therapy Institute.
Great. Kaci, could you describe your company a bit more and really if you just want to describe the industry that you work in a bit more, that would be great.
Sure. So I actually work in physical therapy in the business office, but also we are contracted through Dreyer Physical Therapy, even though we work at OSS Health. So technically, Dreyer Physical Therapy Institute employees are also OSS employees.
Now, so with physical therapy, what's your job title and what do you do for them?
Sure. So my official title is Senior Office Coordinator, but in a easier sense, so you guys understand, it's basically business office management. And I work with physical therapy business office at our Powder Mill location in Leaders Heights, and also our Hanover office on Eisenhower Drive.
Great. I'll just have to admit, I'll throw it on the side. I've gotten to work with OSS and Dreyer a few times over the last year due to something that happened with me and something that happened with my daughter. So it's been a great organization. So it's things are running very well, at least from the patient perspective. So thank you for that.
Great.
So Kaci, how long have you worked in the industry, and are there any other past job titles or roles that you've had before you made it to where you are right now?
Sure. So basically, I kind of started in the business office. I started at our location in Powder Mill about 3 years ago. And then I kind of moved about 5 months later to our location in West York. And there I kind of did some cross training, learned a lot of new stuff, and how the business office works as a whole. So when I did that, it kind of helped to move me to the Hanover location. And I was there for about 6 months after that, and kind of took over like the management role there. So there I was there for about 6 months before I kind of took over a dual role between offices. So I spend half of my time at our Powder Mill location in Leaders Heights. And then I also spend the other half of the time in Hanover with the business office there. Before I actually, what's kind of cool is for healthcare administration, what got me into this role is in high school. So I went to Spring Grove. In high school, I actually did an internship through YCAL for healthcare administration because I always wanted to do something in education, but I know that I like to help people. So that kind of steered me to this direction. And then I went to Penn State for my bachelor's in healthcare administration. Basically, I haven't been in my role super long. And I'm also very young, but I did work very hard. So, for high schoolers, get out there and network. On the side, I also am president of a scholarship foundation for my high school. So I help to raise funds for post-secondary education. So, get out there and network, do YCAL programs. When you're in college, make sure to also volunteer and do things like that because you learn a lot of networking that way. Before I was at OSS, I actually did an internship with WellSpan. And that also, I think, really helped to get in the role that I'm in right now, because I worked with the administrative director of sleep services and learned a lot of cool stuff there, did a lot of projects. So, it's never too early to start networking and volunteering your time, and getting out there in the community. Also, employers really love, when you're doing things outside of your normal role. So volunteering, helping out in any of your free time. When I do interviews, I always ask that, because that's really important to me. And also, if you work for our company, Dreyer encourages everyone to take a free day off. We have a charity day, so that's really important to our company. And for the OSS side of things, they're constantly volunteering, and helping to be at football games. The doctors volunteer at football games, wrestling matches, sporting events, things like that, to get out in the community. So that is very important to employers, especially.
Great. Well, I'll tell you what, the next question I was going to ask you is what kind of training or education did you get to get to your job? So you actually covered that, which is great. I did want to ask, I normally don't do this, but I was thinking how I'm familiar with OSS and Dreyer because of a couple of reasons that I had to visit those offices over the last year. But could you just give a brief overview? What are some of the services that OSS and Dreyer offer? Like what types of what types of people are you working with, and who are you seeing come in through that office? Just for those that may not understand exactly what they do.
Absolutely. So we are an orthopedic based facility, OSS. So I'm just going to speak about the OSS portion, and then I'll get a little bit into how Dreyer works under that umbrella. So OSS does anything related to spine, any orthopedic injuries, replacements, knee replacements, hip replacements, shoulder replacements, things like that. We have our own DME department, so we really try and get those things taken care of. So whether it's splints, we do splint sound and therapy. So if you go to urgent care at OSS, you can come down and get a custom splint done. We also see a lot of work comp and auto patients for injuries like that. We have a work comp program that you can actually come in 4 to 5 hours a day to get you back to work. So that would be considered your work day, half of your work day. But we're basically treating orthopedic injuries. We have at all facilities urgent cares open. We also have a hospital that we do surgeries out of, but we also are doing surgeries at UPMC in West York, and the one in Hanover as well. So a lot of our doctors do surgeries there so that patients don't have to drive to our Powder Mill location. That's a relatively new thing in the last couple of years that we started doing to just make it easier for patients. But through that process, when you have surgery, we have therapy services, which would be the Dreyer side of things. We have 3 Dreyer/OSS facilities for therapy. One would be in Leaders Heights. We have one in West York off of Roosevelt Avenue, and then we have one in Eisenhower Street. So we offer therapy services, trying to get you back on your feet, but also we do have some standalone Dreyer clinics throughout the area. If you aren't really open to like the huge atmosphere, we have some smaller locations. Dreyer has a facility in West York. We have one in Red Lion. So all across, the area for smaller facilities. And that's really helpful, I think, for patients that, with the pandemic, they don't really want to be in a very busy environment. That is an option for them as well.
Great. Yeah, I was a regular at the Dreyer West York location for quite a few weeks. And what really surprised me is how many people were there recovering from surgery, various surgeries, just trying to get themselves back up to speed and hopefully be able to be more independent as they're recovering from their surgery. I'll admit, I was there for a back injury, that was I couldn't I couldn't shake for a while. So, but yeah, my experience was great. I tell everyone I would highly recommend that to anyone if they need it. So
we do help a lot of athletes as well. A lot of our patients are not, only elderly. We see a lot of orthopedic injuries that happen in sports, and we do see a lot of patients in that as well. We also have therapists that specialize in treating athletes.
Yeah, a couple more former athletes, actually, ones that I was talking to, a couple more basketball players, and it's yeah, it was great. And yeah, you're absolutely right. The first time I walked in there, someone yelled across the room because we realized that three of us were there that have all played volleyball together at some point. So it was kind of funny that, like, one was, sadly, I was there on the court when he got injured, so I was like, oh yeah, that's right, that's why you're here. So so well, you were talking about some of the sort of technical training and internships you had. What are some of the personality traits, or maybe like the behavioral characteristics, that you think make for a successful person in the healthcare field?
Yeah, so absolutely empathy. That's one of the first things that we ask, when doing interviews or anything like that. Just having that compassion to really take care of patients. For me, I hate the blood and everything like that. So I went into the business aspect of it, but in many ways, you're constantly helping patients. We do plan of cares. So every 30 days, we have to recertify a patient's care, and we have to get it signed by the doctor, whether it's internal docs or external docs. We get a lot of outside referrals. So if we don't have that, patients are not able to come in. So that's, part of our job to get that, taken care of, so we can get that back, and patients' care does not have to go on hold. We also do authorizations. So certain insurances require you to have authorized visits for therapy, which I'm sure you've probably been through if you have.
Yeah, fun stuff.
Yeah. So we must get authorizations on their behalf in order to see those patients. So in many ways, the business side of things, we are constantly affecting patient care. And so, being very organized, being able to multitask, helping, really outside of your role too. Sometimes we have to do that in healthcare, when things come up. Just really willing to work hard. Also, we are a very fast-paced facility. At OSS, specifically at Powder Mill, we see about 1,000 patients a week. So, things happen and you have to step outside of your role. So, I saw a quote the other day that said about, if you're not willing to step outside of your role, you're not doing it correctly. And I really feel like that is applicable to healthcare, especially the world we're living in right now. I think, OSS as a whole has really taken on a larger volume than we normally are used to, even more so than, what we have. We're very busy, but even more so because a lot of our hospitals, are not really seeing orthopedic stuff right now because, they're taking care of COVID patients. So we have a larger volume coming through with our injuries to urgent care and things like that. So we're seeing a lot more patients there. So really just, when I interview people, I like to just see smiling faces, like just happy to be here, happy to help. Just patients really see that. And when you're in healthcare, you might be the very first person that they experience at that facility. And if you're not positive and upbeat, that they're already hurting and they're already in, frustration and, so many emotions are going on, financial things due to having all these visits or, their surgery, etc. So, you have to do the best you can to just support them and be a positive environment for them, because you are, the first thing that they might experience, and possibly, like, if they didn't have a great experience, that could be their last time there. So, just really trying to be there for patients and know on their end, they know that you care. And I think a lot of our patients, so Out of our Hanover location, I'm a little bit closer with those patients just because we have a smaller volume. And I think just being personable with those patients and trying to get to know them has really helped too, to support them. And, they're always like stopping back and seeing everyone. So I think just, having the empathy that you do, regardless of what role you're in healthcare. You might not be a physical therapist and being hands-on with that patient, but that you are still affecting their care through the various things that you do, whether it's on the business aspect and trying to get them back into the facility or anything like that. So.
Yeah, I think that first one you said, empathy, is I think that's huge in any service you're providing, especially healthcare. So yeah, I absolutely agree with you on that one. On that note, what would you say is the best part of your job?
Absolutely, my patients that we see, and also staff. I mean, I think like at all of our facilities, we work so well as a team. Like our clinicians are supportive of the business office because they know that we, are helping them get their patients in, and vice versa. Like we all respect each other and the roles that we all collectively provide to reach the greater goal, which is, good patient care. And I think just, when it comes to patient care, the best part I would say for me is just coming in every day, knowing that you are supporting the patients, and also working really for a company that you really respect and know is providing the services that the patients need, and there to support them, and not just coming in and this like just coming in for a paycheck. Everyone is there to support each other, help with shifts. I think, this pandemic has really shown light on that as well. And I think across the board, like whether, you're helping in the service industry, in healthcare, or you're helping in management, or you're helping in therapy, or the doctor's offices, just creating relationships, honestly, between everyone is really rewarding, honestly, and seeing patients improve day to day, weekly. We have a bell that we ring every single time a patient's discharged or gets to a certain degree with their knees. We measure the degrees they're able to move, and we ring a bell. Just everyone gets really excited for patients when that comes, and a lot of them get really emotional because we've been there through those steps. So that part's really rewarding too. Or like they come and brag to you like, hey, I was able to get 110 degrees today. That's really great. So
it's just funny. I didn't mean to personalize this because this isn't about me, but I felt that like when I actually had my last session, I got in the car and I felt like almost sad. I'm like, oh, I'm not going to be coming back here anymore because I just graduated today. Because it's like, oh, I'm going to miss everyone because I was there for a couple times a week for 6 or 8 weeks. I don't remember how long it was, but yeah, and then I sent a video of me like basically like diving on the floor for volleyball and getting right back up, and I was like, hey, look at that! Like,
yeah,
we get out of bed a month ago.
It's really great when we get pictures of like longtime runners or hikers, and they had a major injury and they're like, I might never be able to run again. I might never be able to hike again. And then they send us a picture of them hiking or running, and that's really awesome. You're directly affecting what their hobbies are. Yeah. A lot of golfers that don't think that they can golf again. They have like a shoulder repair and they're back golfing. Like that's awesome to see. So.
That's very cool. I almost don't want to ask the next question, which is going to be, what's the most challenging part about your job? I would love to just end it on that high note, but we're only at question 8. So.
Healthcare is fun in that it's always changing. We have a lot of regulations, especially because our facility is actually hospital based, since we do have a OSS hospital. So we kind of all go under that one NPI. So across the board, anyone at those facilities is considered hospital-based. So really just regulations, there's a lot of changes due to government changes in healthcare, a lot of different acts. And I think, I have to really hold meetings weekly with the business office at both locations to kind of keep them up to base with where things are at with any changes. So, really just changes that come through that we have to work through and we don't really have control over. But so right now we're kind of working through a process for PTAs because PTAs, if we see those patients, Medicare is not reimbursing us the total that they would for a physical therapist. So we're taking a hit every single time a PTA treats them. So really, over the last 6 months when we knew this was happening, we kind of sat together and our main focus was patient care. So how do we effectively provide patient care? As long as patients need to be there, we can provide that care. So, we kind of moved around schedules and things like that so we can continue to see them without any interruptions. So really just when things like that come up, that we don't really have any control over, but also I think specifically for me, always trying to find ways to be more efficient. So, cross-training people to lower, unnecessary staffing, and just kind of getting everyone equipped in different things, and trying to be as efficient as possible. So we do all of our own billing downstairs in therapy. And a lot of times that is kind of like their own department. So we do bill out all of our patients downstairs as well. So everyone, kind of has their hands in many buckets to try and be as efficient as possible and keep things running smoothly.
Gotcha. This next question, I kind of seems silly to ask, but we're consistent with these 10 questions. But
yeah,
what's the career outlook in the next 1 to 5 years for the healthcare industry? We talk about that a lot.
Yeah, healthcare is one of those things that's never gonna leave, and as we see, so orthopedically, we're trying to kind of over the next 5-10 plus years, we are trying to constantly offload, major hospitals and take on, because we do specialize in just orthopedic stuff for OSS. So, trying to offload those, I do feel like, we've even really grown when I speak for OSS specifically. Like we had 2 facilities, one was at Powder Mill, and then we had a Hanover location. I want to say 2 years ago, we built our facility in West York to kind of help that population because we did have an East York facility. But we're able to help those patients in that area so they aren't traveling super far.
I appreciate that.
Yeah.
I can almost literally see it from my house. So
when you live in certain parts of York, like Northern York, and you're having to drive to a certain area, East York, we've tried to really establish those facilities. We also do have one in Mechanicsburg, but we don't have a Mechanicsburg OSS therapy at this moment. But even our Dreher clinics, we're constantly creating new ones. We recently opened the one in Spring Grove. So for patients that, don't want to drive to Hanover or they don't want to drive to West York, there's an option there. We also recently opened one in New Oxford as well. So those are constantly popping up, little facilities like that too, for people that live in certain areas, because when you are in therapy, sometimes you have to come 3 times a week. So that's a lot of traveling. And also some of our patients, work in Maryland. We have some Maryland facilities also. There's one in Fallston and Bel Air area, I believe. So, some of our patients do work in Maryland and it's easy for them to go straight from work to therapy. So, we try and offer things like that, but constantly growing field, especially in healthcare management. I feel like, there are so many changes coming that, you always need someone to influence those changes and help to, come up with new ideas for how things are going to work going forward. So I do feel like the healthcare industry is, it's just always going to be there. Everyone's always going to need healthcare. People are always going to need therapy, to get you back on your feet, even in our hospitals. When they do the surgery, we have our own inpatient team that is part of our outpatient team that starts doing therapy with patients when they're in the hospital. So you might be there for 3 days or so at our hospital at Powder Mill, but we have a team that's doing those before you would even see outpatient therapy. So, constantly moving that leg to get movement before you even show up to the actual facility and start your outpatient therapy. And I think that has really helped with the outcomes. So people across the board.
It sounds like a lot of the schools that I get to speak with that are offering healthcare degrees, various healthcare degrees, whether it's in administration or clinical nursing, what have you. It seems like their placement rates are about 100%, which is for those that placement rate is how many of their students are getting jobs in the field when they leave. So it just kind of seems like there's pretty much jobs waiting for everyone at this point. So that brings us on to the final question. You started to touch on this one a little bit, but seeing that most of the people that are going to be watching this, the intended audience is really high school students. What is one piece of advice you would give a high school student looking to get into this industry?
Sure, absolutely. Like I said, networking, YCAL specifically, I think they have great programs.
Thanks for that. Checks in the mail. Appreciate that.
Yeah. Honestly, because I would not have gone into this field if I did not go through that program, because it was not even a thought in my mind, is this something for me? But really just, getting out there in community, it's never too early to start networking, going to events, going to job fairs, honestly. I know Spring Grove's doing one soon that we're going to be at as well. And actually right now, I think is a good time for people to start like thinking about, in the summers, what is my long-term goal? Am I going to be working in healthcare in the future? So if so, trying to get a start on that, getting in the medical field, regardless of what you're doing. Right now, we have a lot of people that work at our facilities that are techs. So they're physical therapy techs, and a lot of them are going to physical therapy or something in healthcare related. So, that has really helped on their resume, because it shows that they're willing to step outside their role, but they're also networking as well, just working in healthcare regardless. Really is something that you should start looking at, over the summers or when you are in college and on winter break, just trying to, be in a basically healthcare facility. And just like I said, networking, helping with fundraisers, that's how you're going to get those people that you run into that work at a certain facility, and then they remember your name when you graduate. Just you can reach out to people for shadowing. There's tons of people out there, if you're thinking about going into this role, reaching out, saying, do you have any shadowing opportunities? Really just spending your time volunteering and doing any opportunity that you can. That's really going to look good when you do come out, and you'll have a plethora of things to put on there.
Awesome. Well, Kaci, that's great advice. Thanks for joining us today. Thanks for sharing your story with how you came into this career. And I know it's going to be helpful for those that are looking to get into your various parts of health science. So thank you so much for joining us today. Really appreciate your time.
Yep. Thank you so much.